Assalamu alaikum guys. Today we are going to talking about central nervous system disorders, but I want to explain you some structure of brain. Our brain covered with layer which is dura mater, arachnoid space and pia mater. These three layer we said that it is meninges. What? It is meninges. Okay? And in brain we have cortex, we have it's totally a cerebrum of the brain structure. In cerebrum we have sulci, we have gyrus, cerebral cortex. Okay, and after the cerebrum, another structure which is cerebellum and spinal cord. Above the spinal cord there is brainstem, which is brainstem have pons and medulla oblongata. Guys, I want to explain you here. Suppose we have brain. Here the brain structure. This is totally cerebrum area, guys. The layer which are present here, we said that it is meninges. Cerebellum present here, and brainstem to the spinal cord, pons, medulla oblongata. These structures are known as brainstem. After that, spinal cord. Here, two hemisphere. Which is cerebral area, guys. Hemisphere. Okay. Remember, when infection in the meninges area, when infection in three layers of the brain due to acute pyogenic bacteria, this is called meningitis. Another point I want to explain you. In the cerebrum area, sometimes edema happen. There is excessive fluid in the brain parenchymal cells. This is called cerebral edema. We said that excessive fluid in the cerebral region, this is called cerebral edema. Encephalus. What is encephalus? Guys, when there is extra fluid, the concentration of fluid increase in the ventricular area of the brain. Okay, what is ventricular area? Remember, in our brain, here our brain, in brain there is four ventricles, two lateral ventricle, third ventricle, and other which is fourth ventricle. Third ventricle, guys, and fourth ventricle. When in the four ventricle, excessive fluid, which is cerebrospinal fluid, we said in the brain, the level increased. This is known as encephalus. Encephalus, guys. And fifth point I want to explain you, there is herniation. Very interesting point. Sometimes herniation happens in our abdomen, guys, and you will never imagine herniation happens in every region of the body. What's the mechanism of herniation in the brain? When there is displacement of brain tissue or there is displacement of one compartment to another compartment, this is known as herniation. Displacement, known as herniation. Here, remember, there is two hemisphere, one here and two here, and second here, and sometimes these hemisphere displaced with each other. One goes left side and other goes to the right side. This is called herniation. Okay? And sometimes brain tissue displaced from their position. Okay? And the sixth point I want to explain you, that intracranial hemorrhage. Intracranial hemorrhage happens due to hypertension, due to any other factors, guys. But we know that our brain have arteries. In arteries, when blood pressure increased due to their normal level, maybe 200, it goes 200. Okay, sometimes blood pressure it is 200. Okay, and sometimes blood pressure is 90, 180. This is known as secondary hypertension. Okay, increased arterial pressure. When there is arterial pressure, blood pressure in arteries increased, it's mean the high level of chances arteries burst. There was rupture in the brain, and bleeding happens in the different parts of the brain, and that damages the brain cells. Okay, guys, because red blood cell in the blood, there is red blood cell. Red blood cell damage the cerebral regions. Okay, bleeding in the brain, due to hypertension. This is known as hemorrhage. There are four types of hemorrhage: epidural, subdural, intraventricular. Okay, here. Sometimes hemorrhage happens here and sometimes hemorrhage happens here. This is known as epidural, subdural, intraventricular, ventricular, and intracranial hemorrhage. The one of the most dangerous hemorrhage in the brain, which is this region of the brain. Here I'm showing you. Most dangerous hemorrhage in the brain, subdural hemorrhage. Another point I want to explain you, our brain have neurons. Okay, sometimes neurodegenerative disorder happens. These diseases known as Alzheimer's disease and Parkinson's disease. Alzheimer's disease happens when the age increased of the person, and due to Alzheimer's diseases in the brain, memory loss, memory dysfunction, okay, and Parkinson's disease due to it's a neurodegenerative disorder. They damage the neurons. These diseases damage the neurons, and Alzheimer's disease. When Alzheimer's disease happens, you guys, there is difficulty of movement. There is difficulty of writing the words. You cannot move from one place to another place easily. It's due to Parkinson's disease. Two kind of diseases, neurodegenerative. There are several neurodegenerative diseases, but in central nervous system, some diseases happen, which is Alzheimer and Parkinson's disease. And in the central nervous system, and other point I want to explain you, in the central nervous system, tumors forms. Two types of tumor, benign and malignant tumors. There is abnormality, growth of the cell in the brain. This is known as tumor. This is known as cancer. And you can treat tumors easily during surgical procedure, guys. I think this is short information enough for you, and guys, you can write on your notebook and enjoy my videos. Thank you so much. We will discuss peripheral central disorder in the next lecture. Thank you so much.